Good afternoon, everyone. It's a couple of minutes after 2, so we're going to go ahead and get started. Thank you all for joining us today to discuss the reopening of the Birmingham region. I'm Fred McCollum, Interim President and CEO of the Birmingham Business Alliance. And we have a great group of experts here joining us today. I know they're ready to talk with us and take your questions, and we'll get to that in just a minute. First, I'd like to just give you an update on the work of the Birmingham Business Alliance during this COVID-19 extravaganza that we've been about here over the last several weeks. Most of you are familiar with the Birmingham Business Alliance, but if you're not, we're the lead economic development organization for the 7-county region, Birmingham region. Our mission is to lead a regional growth strategy and deliver services that create high-quality jobs and a resilient economy by attracting, retaining, and growing companies and talent throughout our region. So during the COVID-19 period, we've been focused on helping small and mid-sized companies one-on-one, and have also focused on bringing accurate and up-to-date resources to the business community in general on our website, which is birminghambusinessalliance.com. As of today, we've reached out to and provided services to nearly 550 small and mid-sized businesses in the last 6 weeks to provide assistance and connect them to resources. Many of these companies are our investors, and some were provided buying in partnership in helping the city of Birmingham's Birmingham Strong initiative. Right now, we're basically doing anything we can to support, guide, and provide resources to Birmingham businesses, both during this crisis and beyond, because that's what we are about. I want to thank our investors who are on this call for their support of the BBA. It is your support that makes what we do to grow our region possible. So today's a big day for businesses across Alabama and in Birmingham as Governor Kay Ivey's Safer at Home plan to gradually reopen businesses goes into effect. I know many of you are anxious to see your businesses reopen with a cautious and mindful eye to doing it safely and with the health of your employees on the top of your minds. That's why we invited Dr. Scott Harris, who is our Alabama State Health Officer, Brian Hale, who is the General Counsel to the State Department of Health, and Dr. Mark Wilson, who is the CEO of the Jefferson County Department of Health, to join us this afternoon and answer your questions. I'd like to take a moment to introduce briefly each one of them to you before outlining the format for how we'll proceed with today's webinar. First, welcome to Dr. Scott Harris. Dr. Harris was named Alabama's 12th State Health Officer in February of 2018. He earned his degrees from the UAB School of Medicine and the UAB School of Public Health. He left private practice to join the Alabama Department of Public Health in 2015 as an area health officer for 7 North Alabama counties before he assumed his current role as a state health officer. Welcome, Dr. Harris. Thank you for being here. Dr. Harris is joined by Brian Hale, who's the General Counsel of Alabama Department of Public Health. He has been with the Department of Health since 2004 and will be assisting Dr. Hale with any legal questions that we have today. So welcome, Brian. Thank you for being here. Finally, Mark Wilson is a health officer for Jefferson County Department of Health here in Birmingham. Dr. Wilson has held this position since 2011 and oversees various programs for Jefferson County. He has served the Jefferson County Board of Health and worked for over 20 years as a general internist in healthcare at Cooper Green Mercy Hospital. He has a medical degree from UNC Chapel Hill. Go Tar Heels. Thank you for joining us, Dr. Wilson. Program, before we get into the questions, I'm going to ask Dr. Harris and Dr. Wilson to provide us their comments and updates on where we are today and where we're headed as a state and a community. So with that, Dr. Harris, I think I'll turn to you first. Thank you, sir, for being here with us, and the floor is yours.
Thank you very much, Mr. McCallum. Thank you very much for having me today. I really appreciate this opportunity to meet with you and to speak with you directly and look forward to questions. This is a great opportunity for all of us. Let me just start with just kind of giving you a snapshot about where we are as a state. Over the past about 6 or 7 weeks, we've now have around little over 7,000, almost 7,200 cases of COVID-19 in our state. That's resulted in about 280 deaths that we know about so far. Kind of what's striking about this is similar to what we've seen in other parts of the country. This is a disease in which deaths are disproportionately occurring in people that are older, seniors, but also disproportionately in people that have chronic health problems, which unfortunately, includes a lot of Alabamians. Things like diabetes and heart disease and kidney disease do put people at risk more so than other things. Because we have a lot of chronic disease, especially in our African-American Alabamians, we see that close to half of all deaths are occurring in Black Alabamians, even though African-Americans only make up a little over a quarter of our population. So that's unfortunately a racial disparity we see not just with this disease, but we see with a lot of diseases in our state. We currently have cases that have been reported all throughout the state. As you know, Jefferson County was one of the first to recognize this, and Jefferson County has done a great job of ramping up their ability to test and to trace these patients. Certainly commend Dr. Wilson for what he's been doing there. It's been a really tough job in Alabama's largest county, and he's done that very, very well. We are seeing outbreaks now throughout the rest of the state. The county with the most cases and the most deaths now is Mobile County, which is our second most populous county, but still significantly smaller than Jefferson, and yet they've surpassed Jefferson County in terms of deaths, in terms of number of cases, and currently have the most hospitalized patients in their hospitals of any county in the state. We have other outbreaks that are ongoing. We know of one of Alabama's largest cities has an outbreak within its municipal jail that we are dealing with. We have had a number of nursing home outbreaks, as you know, somewhere around 70 or 80 nursing homes have had cases. There have been almost 100 of our 280 deaths have occurred in nursing home residents. We have also had a handful of deaths among staff who work in nursing homes as well. We continue to have outbreaks that affect our healthcare workers, around 1,000 healthcare workers, not counting those in nursing homes, but those that work in doctors' offices and hospitals. Around 1,000 of those healthcare workers have been infected. And even though we've had a few deaths, not a lot of deaths in that population, those are people who are out of work for a while. Those are people who get infected and unfortunately have to go home and hopefully avoid becoming very sick, but are out of the workforce for a while. So we certainly felt like that the governor's decision to have a shelter in place was a good decision, despite all the hardship that has caused on people. That's a very difficult decision, and for a disease that doesn't have a vaccine or really even a definite treatment right now, really the only tools we have in public health are to try to keep people apart, to try to test and find cases when we can, and then to try to track down those contacts of people when we pick up on a case. And those are literally the only things that we know to do for this disease right now. Obviously, we certainly understand that getting the economy back open is necessary and needs to proceed. Governor Ivey has taken what I think is a very prudent approach. It's cautious, and yet it's certainly tempered with the knowledge that she has to balance both the health and safety of our state, but also the economic health of our state as well. What we are trying to do to make those decisions easier for her is to ramp up our ability to test throughout the state. I know that I've been given several questions about testing, and I'll be very happy to talk to you about that when we get to that point. But I'll just say briefly that we do have testing available everywhere in the state, but we don't have testing easily available in all parts of the state. There's certainly many counties like yours in Jefferson or more urbanized centers where testing is fairly available or even readily available. But then we have many parts of our state that are rural, or some that don't even really have a healthcare infrastructure much at all, where testing can really be a challenge. Even though we can get there and get people tested sort of one at a time as we need to, it's not something that's easily available to people. So we continue to advise the governor the best we can on the next steps to take from a public health standpoint. We certainly, again, recognize there's a trade-off between having businesses closed and trying to protect people from being sick. So as we proceed to reopening, we certainly welcome that, and yet at the same time, we want people to understand the importance of being safe and protecting vulnerable people, not only our seniors, but also those that have chronic health problems, which represent, in fact, quite a large number of our workforce as well. People with diabetes or heart disease or cardiovascular disease or other issues. So I think I'll just pause right there, Mr. McCallum, if that's okay, and then turn it back to you.
Getting on and off mute on this Zoom thing is the hardest thing in the world. Thank you, Dr. Harris. I appreciate it. And we'll get to questions here in a minute. But for now, let's turn to Dr. Wilson, and thank you for being here as well. And turn to you for some insight into Jefferson County and today and what's going on and where we headed.
Yeah, hi everybody. Thank you for having me on. I just similarly just give you an update locally. We have a little over 900 cases now so far. We're at about I think 46 deaths last time we looked. And our hospitalizations in the Jefferson County area peaked a while back, but it looks like they've sort of plateaued at this point. They've not clearly come down yet. Similarly, our cases I think I announced maybe 10 or so days ago, maybe 2 weeks ago, that we looked like we were going down in our number of cases. That was very encouraging. Since then, it's sort of been up and down a little bit day to day. We've had some blips on the screen of increased numbers. Some of that is coming from our nursing homes. Unfortunately, it has gotten into several nursing homes. This is not unique to us. It's really a national problem. It's tragic. And we really tried very hard to keep that from happening. But nonetheless, it's with us now. And that's one of our greatest challenges right now from a public health and contact tracing and testing standpoint. And it's a real gnarly problem as well in terms of how do we manage that. So there's a lot of very active discussions and problem solving going on with our local hospitals and the nursing homes. And our public health department and others to try to figure out how to manage that. And that's a statewide discussion as well, but that's one of the things that's worrying us the most right now. The numbers haven't just overall just really done a definitive 14-day decrease, either in terms of cases or hospitalizations or deaths for that matter. So technically speaking, when we got to this point of opening up more businesses, we were not, if you're a purist from a public health standpoint, we were not quite ready. But I think that the governor made an excellent decision in terms of balancing all those demands, as Dr. Harris said. And I also am very, very proud of the process that Alabama had. I mean, it was very robust in terms of all the input that came from the business community and the public health community and others, very diverse input. So I'm just really proud of Dr. Harris and the mayor and all of those that advised both of them. I think Alabama should be proud of that. I think we did as good a job as possible. I will tell you also just a few things locally that we've been doing in public health along with our partners in this unified incident command structure that we're in. Very early on, we were really worried about these congregate living situations, nursing homes certainly, but other places where people are living in close quarters and sometimes don't have a choice but to live in close quarters, homeless shelters, our jails, other group homes and substance use treatment, residential facilities, things like that. So we've been working very hard on that since the very beginning to try to protect those populations. And it's not just about those people that are in those settings, it's about all of us, because if we have an outbreak there, There are people that work in those places. We're all in this together. So, and of course, that would also put strain on our hospitals. But of course, we do care about all the people in those settings. Those are our most vulnerable people that are falling on hard times sometimes. And so we're very, very committed to them. And I think we're blessed in Birmingham, too, to have a very generous and caring community that certainly cares about those who are less fortunate. Our jails were very fortunate early on. Our judges really helped us out by getting some people out and preventing too many from coming in. So they were decompressed very early. Our homeless shelters have been basically on lockdown the past couple weeks. And we're helping to get people that are going to be going into shelters tested. We've set up a site to do that and a quarantine site to do that. In terms of testing access, we are very fortunate here in Jefferson County, and I certainly can't take credit for a lot of that. We have Christ Health Center and Cahaba Medical Care and the Assurance Lab down on 280. Other partners that have really stepped up. And UAB has been an amazing partner for us, setting up that UAB test site and a centralized call center. We've been working with them to help staff that and help support that. Our health department also is paying for anybody who's uninsured who needs a test. We're covering that cost. And then those federally qualified health centers I mentioned earlier, they're also providing the tests for free for people that can't afford it or don't have insurance. So there's good access in terms of the ability to pay. We still are expanding out places for testing, and in particular, some of our underserved areas, we're looking at the health equity maps that we've produced before to try to get those areas that are most hit by health disparities. And then just looking at the overall map of Jefferson County to make sure that we're filling in gaps in terms of test sites. And we are indeed building up our capacity to do that contact tracing you're hearing about. We're fine right now. We're very well staffed in terms of tracking down those that are positive and then tracking down their contacts and getting them quickly quarantined. But we're also building up our capacity to do that, working with the state health department on that. But we're staffing up and also looking at various technology platforms to support that. Also, in terms of the businesses that are going to be opening, including the retail that's coming online now, but other future situations, our environmental health department that regulates a lot of businesses is ramping up and has ramped up, putting in extra hours, also weekends, to help businesses comply with the CDC guidelines and the social distancing guidelines. As I believe is our tradition at the health department in terms of our regulatory work, our folks in environmental health are supportive. They try to help business succeed. And that's our goal now, is to help them succeed. I know that business people that are opening businesses, they want their employees to be safe. They want their clients to be safe. They want to get it right. When these orders first went out in mid-March, we got tons and tons of phone calls from businesses. There were a few that wanted to maybe look for loopholes, but by and large, everybody just wanted to do the right thing. They were calling for clarification. How do we do this? How do we get it right? So we're here to help, but we do have a big job ahead of us as things do open up to support businesses, help keep them safe, and also support our community and keep them safe. So I'll leave it there and see if there are other questions later. Thank you.
All right, thank you, Dr. Wilson. We're going to get to some of the questions. We had a lot of questions that were submitted by our participants today beforehand, and we got a lot of good ones from them, so I'm not sure we'll be able to cover all of them. We have tried to consolidate some of them, and I'll just kind of walk through them. For our audience, if you have any follow-up questions that we don't cover today for us that we can help you with, please visit our resource page on the BirminghamBusinessAlliance.com website, and we'll do our best to get you an answer as quickly as we possibly can. And also, Dr. Harris, I know you have another commitment at 3 o'clock, and we need to finish this up several minutes before that, so we will certainly accommodate that. I thought I might start in the testing arena and maybe back up a little bit to just some common terms that we're hearing used nowadays that maybe not everybody has a full understanding of what those mean. I'm looking at I know one of the guidelines that you all have been looking at amongst many is the White House guidelines on opening up America that talk about the ability to have testing of symptomatic individuals and trace contacts. Dr. Harris, I'll call on you, but I don't know if I am calling the wrong one. Y'all feel free to pitch it to the other one. But can you give us kind of a picture of kind of where we're looking to get to in the testing environment to be able to have the ability to cover both symptomatic patients and what is kind of trace contacts and that process, and how is it evolving and how will it be evaluated and tracked?
Sure. I'll be glad to do that, and Mark can certainly jump in too. He does that every day as well. So just to kind of as a little bit of background, I'll tell you the way that public health, has always worked, or long before COVID-19 was on the scene, is that there are certain diseases that have public health significance because of the potential for outbreaks, for example. And so, for example, something that probably is immediately recognizable is if there were an Ebola case in our town, public health would know about that right away, and we would want public health to know about that right away because of the implications of making sure people are protected, the public is protected. And so there is a process so that when someone is diagnosed with COVID-19, whether it's a provider who's made a diagnosis in a patient, or more commonly a laboratory that's doing a test that shows someone has COVID-19, then that provider or those labs notify public health as quickly as possible. In the current situation, they're required to notify us within 4 hours of when they get a positive test, so that we know about that person out there in the community. So once someone is diagnosed as positive, then we have epidemiologists that do an investigation of that. We don't just take the lab as the final say, but in fact we actually get in contact with that patient, or if that's not possible, we get in contact with that healthcare provider who diagnosed that patient. In fact, we try to do both, and then we actually learn the details of that case, and in some cases review medical information that we have or that we can get. In some cases, there may actually be a death involved, and that's a different set of processes, but similarly looking for the same amount of information that we can gather. And so then we can confirm that that person as an actual case. We actually recognize there's a definition that's set by CDC that all states use equally, so we make sure we're all comparing apples to apples when we talk about our numbers. And then so we confirm that as a case. So then the next step is to make sure that person who's diagnosed knows what they have and knows where they need to seek care if necessary. But then because this is an infectious disease and it transmits between people, we also do what Dr. Wilson just referred to. We do contact tracing. So we find out from that person, if possible, or from the family, if possible, who are the people close to you that could have been exposed to you and picked up this disease as well. And so some are obvious, that people that are intimate partners or people who live in the same household. Some may not be as obvious. If somebody went to a business and spent a long period of time, or maybe in a workplace, sometimes it can be tough to tell who they actually spend a lot of time with or who they don't spend a lot of time with. Did they take a long car ride with somebody that they wouldn't normally be around, but somebody who might have become exposed? So we identify those people who were considered to be close contacts, and then we contact those people and we give them information and say, we think you could have been exposed to an infectious disease, and we need you to quarantine. We need you to isolate yourself. We need you to get out of the general public to every extent possible and stay away from people for a certain time period. So typically we say we stay 14 days. This illness, when people become sick, they usually become sick anywhere from a couple of days after they were exposed up to a couple of weeks after they were exposed. Typically it's about, I think, 5 to 6 days, 6 to 7 days, but anywhere from 2 days to 2 weeks. So this is actually the one and only tool that we have to stop COVID-19 transmission, is that we have to find people who are sick, find the people they could have given it to, and then have those people stay away from others until we make sure that they're not going to get sick. Or if they get sick themselves, then they have to, receive care and stay out of the public as well. So that's what public health has always done. We've done it. We do it with things like tuberculosis, and we do it with things like sexually transmitted diseases like syphilis, and that's just a normal public health process. What's really different now is that with COVID-19, we really didn't have a test until just a few weeks ago. We didn't have the ability to detect people very well. And the numbers came on so suddenly and with huge numbers of people that our ability to contact and trace those folks was really, really limited. And so we've had to really quickly step up how we can test and then how we can trace. And, I won't go into a ton of details, but I think everybody's familiar with the fact that every single state has had trouble getting their testing up. This was a test that didn't exist 3 months ago. There was no such thing as a test for this just three or 4 months ago. And so everything started from scratch. Many of the folks who are doing testing, even here in Alabama, have designed and built their own test. The test that's being used by UAB is a little different than the one at Assurance, is different from the one that's being sent to Quest or LabCorp or so on. And so they're all looking for the same thing, and they're all valid tests, but those have been individually developed, and by people who know how to do that. So the testing has really just begun from literally zero up to where we are now. So we need to continue increasing testing. There's a lot of goals about where we think we ought to get as a state or as a country. There's no clear consensus on that, but one ballpark figure would be about 1% of your population every week. Some people have used that number. We probably are going to use a number a little bit lower than that, but that's still thousands of tests a week in a state with almost 5 million people. 50,000 tests a week would be a lot more than we're able to do right now. By comparison, we're in the whole 2 months we've been doing this, we still only have about 100,000 test results that we received here, and we'd like to have 50,000 a week or at least some significant portion of that. So that's where we are on testing, and I'll be happy to tell you what all of our options are and all the ways that we're trying to increase that. In terms of contact tracing, there's a lot of options out there. Some of it just involves hiring staff, of course, but then it takes a while to train them and get them up to speed so that they know how to do that. It's really a difficult process if you think about what the job is, to do contact tracing. You call a stranger and you say, hello, I'm from the government and I can't tell you the details, but you might have been exposed to something and I need you to tell me all the people that live in your house and what their phone number is. And that's literally what the contact tracing process is like, and you can see why that can be really challenging to do. And so we're looking for ways to automate that. There's some great electronic tools out there that let people use their cell phones so that we can know where they've been and who they've been around. But then naturally there's privacy concerns about that are pretty obvious, you can see, and some people just don't like technology that much. And so there are a lot of ways that we're trying to get around that problem, but until we have a vaccine or at least an effective treatment, really the only tools we're going to have are going to be to test people and then go out and try to get them isolated as quickly as we can. And that's our strategy going forward. So I'll ask Dr. Wilson if he's got anything he wants to add on that.
Hard to beat that.
Okay.
All right,
So I hope
so it seems like as you increase the amount of testing we do, and thus you increase, I assume, the kind of absolute number of positive tests that you have, you kind of have an exponential increase going on, at least for some period of time.
Yeah.
Is that what has been happening, and how are we trying to kind of trying to get ahead of that curve and move closer to that 50,000 number, and any estimates on timing on when we might be at a comfort level on that, Dr. Harris?
Sure. So the first part of that you pointed out is a really great point. The more you test right now, the more we're going to find. And so we're not going to rely strictly on one single number of, the total positive tests have to go down before we can make any decisions, because obviously it makes a lot of difference if you're testing a lot versus if you're testing a little. And so one thing we certainly do our best to do is compensate for that by looking at the percent of tests that are positive. You know, when you do a certain number of tests, what percentage is positive? And if it was 15% a couple of weeks ago, and now you're testing, you know, a different number, but it's only 5%, and you're still trying to test the same groups of people, then that's an encouraging sign. And even though the absolute numbers, you know, may not be exactly, you know, necessarily going up or going down or whatever. So clearly we have to account for the amount of testing that we're doing in order to make sense of those numbers as we make decisions about opening things back up. As far as our capacity, you know, if you take all the labs who are reporting to us, all the labs that are doing tests on Alabamians and reporting those results, they have enough capacity. If you add up all those labs and all the slots they have open in their laboratory, we have enough slots, I guess you would say, to run 50,000 tests a week. That's not actually an issue. The issue is where those tests are actually distributed, and I kind of mentioned that a little bit earlier. If you're in Jefferson County, you know, most of you listening today could go get a test today, you know, if you needed one, without a lot of difficulty. But that's not true in a lot of our black belt counties or a lot of our wiregrass counties. Even though the total number of available tests out there, you know, is probably adequate for our population. So really where we want to get to as a state, and we're not going to get there soon. This is not a criteria for opening up or anything, but the vision we have that we'd like to get to as a state is that anybody who needs a test can get one the same place they get their normal health care. And so if you go to your doctor's office or you go to your clinic or your community health center or your urgent care, if you need a test for COVID-19, then that can be done, you know, right there, essentially right there, the way you would get your cholesterol checked or your blood sugar checked or so on. We're a long way from that, and we won't get there in the next several months. It's not necessary to get there before we make decisions about moving forward, but that's really what we would like to see, is that it's just a normal part of your health care and where we need to get to. We have some issues with knowing exactly what our numbers are because of the people who report to us don't necessarily report all the negative tests to us. And so, as I mentioned, we want to know what our percent positive is. Well, all tests are sending us their positives. They understand if they get a positive test, public health needs to know that right away. But in order to get the negative results, that's what we have to have in that denominator to calculate our percent positive. We have a hard time getting those because a lot of our tests are not even done in Alabama. You know, a clinic or a hospital may have a contract with a lab in Texas or California or New York. And so even though those labs are supposed to report all test results, including negatives, really a lab in California is just not going to go through the time and expense to set up an electronic reporting system to send all their negatives back to Alabama, particularly if they're not getting a lot of a lot of business from Alabama. You know, there's just not a good way to do that. So even trying to calculate those rates, we have to try to read into it a little bit and try to make some guesses and estimates. And so those are really the challenges we face around data. And I would just say, I think there's a lot of anxiety that, you know, we're hanging really closely onto these criteria, and if we don't see exactly this number reach this trigger, you know, we're never going to move forward with the economy. You know, that's not the case at all. It's all a part of using all the different bits of data we have, you know, looking at other factors too. You know, we're concerned about what's happening in Georgia and Tennessee and Florida. I mean, I think those are factors that the governor's got to consider when we talk about opening things back up. You know, we're looking at our hospital status, how many hospital beds are open and ventilators are open, and do we have enough capacity to handle what they normally should be handled. So all those are factors that are taken into consideration.
Thank you. Can we, why don't we move to this magic 14-day time period? And at least in the White House report, it says it defines as a downward trajectory of documented cases within a 14-day period. And I know we have not reached that yet. I guess the question is there a way that just the common citizen could know, looking at your website or data, could you give us a rough idea of kind of how y'all look at calculating that 14-day period? And is there a way that citizens can get data? I know you've got a lot of good data on the state website. could kind of get a feel for where we are with that as we go along, because there's going to be, as I understand it, more than one 14-day period probably, if you follow the White House guidelines at least, involved in the phasing in and the opening up of the economy.
Yeah, I'll say that, and Mark may want to jump in on that as well. But yeah, we do have that data on our website. The public can go there and see how many cases we have per day, and we are talking about ways to try to make that a little more user friendly for people to understand it. Clearly, a 14-day decline, in our view, doesn't mean that you can never bounce back up for a day, because, right, because sometimes we just get data reported to us in bulk. And so a lab may send us all of the tests they did, they maybe send us the positives, but yeah, if it arrives at 11 p.m., it goes in the computer at one time, and if it comes in at 1 a.m., it goes in the computer at another time. So clearly it doesn't mean that there can't be a little bit of seesaw, but the things that we track are we look at rolling averages over 3 days and 7 days and 14 days. And so, we kind of look, what's the 3-day average today? What's the 7-day average today? What's the 14-day average today? And what we want to see is that number going down. I'm not positive if that's on the website. I mean, all the hard numbers are there, but maybe not that graph. But clearly, we need to make sure that the public can see that. We've shown it a lot of times when we've done press things, but we certainly want the public to feel like they have access to that as well. I can tell you we've seen a decline statewide for the past 7 or 8 days on the rolling average. But, again, not necessarily every day, but the rolling average has looked good. But that doesn't apply to every county. That's not the case in Mobile County, for example. Mark, do you have anything to add to that? Or?
No, I think it is a little challenging. I like the rolling average thing is good because you're going to see some random ups and downs from day to day. And there is that lag time too. You can think you're gone down, and then all of a sudden you'll get some results from 2 days ago, and then it's like, oops, you're back up again. So that's a little challenging. I don't think our website shows it that way. I think that might be helpful to the public for us to look at that and figure out how to show them that trajectory and which way the slope is going. Because I think they're just seeing our absolute numbers each day. So I think that would be helpful.
Thank you. So I'll give you the specific question that we got, and then I may jump a little bit after I butcher the terms in it. Is our state allowing our doctors to treat patients with the hydroxychloroquine and remdesivir products? Who makes these decisions? I think I might take a more general approach to that, to status of treatments and how are we coming with those treatments. It sounds like, at least from the national level, we may have kind of made a little bit of a breakthrough with remdesivir. But can y'all kind of talk to us a little bit about kind of the status of those treatments and vaccines, if you have any information on that?
I can give that a stab and let Scott correct me. How's that sound? In terms of the hydroxychloroquine, that drug's been around forever. Nobody's telling doctors what to do necessarily. I mean, they're free to do what they want to, make their own clinical judgment, but it's generally not being recommended because there's some potentially serious side effects, and we don't really have conclusive evidence in terms of how well it works. There are also some supply concerns there too, because there's some rheumatologic conditions and things like that that are treated with that medicine, and some people that really need that, at one point were having trouble getting it because there was sort of a run on it at pharmacies. The remdesivir, there was some recent data, preliminary data out about some of the studies going on at multiple hospitals. UAB has been a big player in that. That data is encouraging, but it's not the magic bullet. It's not like it suddenly just cures you and you can just jump out of bed and hop around and sing a song. It shortens the duration of symptoms, and there's a slight trend towards improved survival, but it was not statistically significant. I think there'll be more data that will help clarify that. But I think it's a little bit analogous to the antivirals that are used for influenza. Again, don't necessarily cure you. If you get the flu, it's not like you take it and you're suddenly better. It helps some people, but we're still going to have the flu, and we're still having people die from the flu, even though we have some treatments for it. So I think this is a little bit analogous to that. And you know, the vaccine, I think we've heard that maybe we could have something, you know, within the year, but you know, when it'll be widely available to the public. And even that, how effective will that be? We don't really know. Again, you can use the flu shot as your analogy. The flu shot is not 100% effective. Sometimes it's not very effective at all. Some years, we still recommend it, and it saves lives, but it doesn't necessarily eliminate that disease in the community. So there's just a lot of unknown at this point.
If I could just add, you didn't ask this specifically, but something kind of in a similar vein has to do with whether people are immune or not after they get infected. And I think that's a real important part to this discussion. And I'm sure you've seen there are a lot of antibody tests for COVID-19 out there for this particular virus out there. And you know, you can probably go get one of those right now today in Jefferson County as well. I think there are a lot of people doing those. Those have a lot of potential to tell us who's been previously infected and whether they're immune or not, but we just don't know that right now. The results of the test, they're a good test, and they can tell you if you make antibodies or not, but we don't really know what that means if you make antibodies. And so, you know, an example is, you know, we can test you, for example, for antibodies to chickenpox, and if you have chickenpox antibodies, we know you're never going to catch chickenpox again, and you don't have to worry if somebody in your house has chickenpox. But on the other hand, if you ever had whooping cough as a kid, we can check you, and your body will make antibodies to whooping cough, and yet people can get whooping cough over and over. You know, so just having those antibodies doesn't necessarily protect you. So we don't know for sure about this coronavirus. We know that there are a lot of other coronaviruses where you do get protection for a little while, for months, you know, and maybe a year, but that doesn't mean you can't get them again next year. But, you know, who knows? It's possible that having coronavirus antibodies to this COVID-19 disease will protect you forever. And when we know that, we can make a lot of really good decisions about when people are safe to go back to work, when people can be in the hospital, do they even need to wear protective equipment or not, and so on. So we'll be excited to learn that information.
So let's take a minute and kind of turn to the future. I'd be willing to bet y'all are thinking a little bit about the summer and the fall and what might happen then. We're all hearing about a potential recurrence. I don't know exactly the right word in the fall, but back to school obviously is being talked about at all levels, including football seasons. And you don't need to go, well, we can go there, but or generally. What is y'all's, I know y'all are doing some work and thinking about the future and what might happen in the fall and what actions y'all are taking and we, the public and businesses, can be taking to help put us in as good a position as we can be in.
Yeah, I don't have my crystal ball. Scott, do you have yours? I think I see it.
I saw Scott had one there a minute earlier and he put it away.
Yeah, I'll just, well, I should have said that so Mark would have to talk now, but clearly we don't know. You know, we're not sure if there's going to be seasonal variation or not. I mean, there's definitely hot weather countries in the world or countries in the southern hemisphere that have had a lot of coronavirus going on, and so you know, it's hard to know what conclusion to draw from that, but it certainly can be transmitted in warm weather, and whether that's to the same degree in the U.S. or not, we don't know yet. Again, I think that as we open things up, as we inevitably will do, you're going to have more people who have the potential to get exposed. And what we hope is that we make enough changes in just the normal way that we have, you know, that we do life, that we can minimize the exposure to those people who are most at risk. And so just, for example, business practices that involve social distancing and certain types of protective equipment and so on, we hope will be enough to kind of help minimize that. I think when we get through the summer and get through the fall, it's hard to believe we won't have outbreaks again. I mean, or maybe we'll be continuing to have outbreaks all throughout the year. I think we would like to see that, maybe the average everyday community transmission where we're getting positives from almost every county every day. We hope that certainly goes away. But I think almost the best we can hope for is that we'll continue to have these outbreaks where we have a nursing home or perhaps we have a jail or a dormitory or, some other facility where we see outbreaks from time to time, and we've got to be ready to respond to those really quickly.
Yeah, I think there's a lot of managing expectations we got to help our public with. People are already really tired of this, and we've just got to really help cheer people along. I think my wife and I have been extremely careful, and but we could get this and both die, in October, because we're, if we've really been careful, we're probably not immune. So. It's just going to be a new way of life for everybody, and we've got to help people understand that and not think that, oh, after we get to this point, we're all good.
So, getting close to the end here, but as businesses are reopening, I know in the governor's in your order, there are some specific kind of hard mandates about distancing and things like that. But a lot of businesses also want to know where can they go to get additional information on best practices for safety, where they can go to for information to get to know more about what they should be doing to protect the safety of their employees and their customers. Any kind of input on that?
I would say, first of all, there's so many different types of businesses and industries that do have their own specific guidance for their groups. And we've relied on a lot of that in helping to make our own recommendations. And so many different, for example, hotel industry, the restaurant industry, the things that are regulated by cosmetology, there's a lot of those types of professions that do have, industry specific guidance out there that you would, just find on their websites or through their normal channels. We have a lot of that's on our own website, alabamapublichealth.gov, that has links to a number of different things. We particularly have things related to healthcare facilities, to nursing homes, to medical practices, but also to the public at large as well. And then I think cdc.gov probably has the most comprehensive list of those materials. Really just about whatever you can ask a question about, there's probably something on cdc.gov that's related to it. They have lots of guidance for schools, for the judicial system, for janitorial services, for undertakers. I mean, I'm just thinking of a few I've read in the past few days. There's a tremendous amount there, and so that's a great place to start.
So well, maybe next the final question, but Dr. Wilson, I know that according to the governor's order, and frankly, when we went through this initially, the Jefferson County, you issued an order specific to this area that was different, a little bit, I guess different, maybe a bit more restrictive, but probably reflected the physical demographics of our region. I don't want to pry, but can we expect that you might have an order come out, or are we going to kind of stick with the state order, or where are we on that?
Yeah, so the way the state orders it, and Dr. Harris, Scott and I have been in close touch all along and talked about this every step of the way, and I appreciate his support, his guidance. Yeah, I mean, I did sound the alarm pretty early, and I think I stated my reasons for that. And I'm glad I did that. The way the orders are written, the statewide order is statewide, and it is coming from Dr. Harris and not me. There is a provision in there that I could do something more stringent. I've threatened to do that a couple of times, with the big box stores that were really worrying me a lot. But I don't have any plans right now to, and I can tell you, I don't ever want to do it because it just creates a lot of confusion. We start getting a bunch of phone calls and stuff like that. And there's also the problem of, Jefferson County is not an island unto itself. So, sometimes it doesn't make sense to have an order in Jefferson County alone if Shelby County isn't under the same thing. And that was one reason Dr. Harris helped me out very early on. One day after my first order, he went ahead and extended it to the adjacent counties because we're a metropolitan area. So there's, you know, there are all sorts of unintended consequences and things like that that we do think about. But no, I don't have any plans. I'm really very pleased with the decision that was made for, you know, this current order. I know that a lot of people are happy, a lot of people are unhappy, but I think it's about as good as I could have expected, considering that we do still have, you know, I mean, we're still not meeting those White House parameters yet. So, but no, I don't have any plans at this point.
So one final question, going back to that. This is the most popular question I've heard on every meeting and Zoom meeting I've been on, and that is, Dr. Harris, when are we going to be able to go to our barber shops?
Yeah.
So, any prediction there about kind of, and I realize there's a lot of uncertainty about all of this, but people want to know when they get back to their hair salons and their barber shops and the restaurants. What's your current thinking about that?
Sure, that's a great question. It's also the number one question I get at my house when I wake up every morning, if you know what I mean. So yeah, clearly, you know, we have to find a way to do that safely. You know, that's a normal part of life, and we understand that for people, but also it's a livelihood of so many people, and we absolutely recognize that's got to be done soon. So the whole reason behind, you know, what we've tried to do just has to do with understanding the risk of how this disease gets transmitted. And, you know, it's a viral infection. It's usually transmitted by, you know, coughing or sneezing or droplets, but certainly can be by touch if someone has had symptoms or someone's infected. And so we've tried to be really deliberate and think through, you know, how is it that people get put at risk. And so so we had a little bit of loosening this week. The governor wanted to move forward with that. I totally support that, but we had not met these complete criteria, and so I think she made a very wise choice. You know, we opened some things related to retail, makes perfect sense. The professions where people literally, you know, put their hands on the public, you know, for extended periods of time are just a different category of risk. And now, it doesn't mean it can't be done in a more safe manner. It absolutely can, and we've gotten some great information from the cosmetology board itself, which has made a bunch of suggestions that we think are terrific, and I'm sure we're going to adopt as soon as we feel like we can safely do that. You know, you can certainly do hair care and all of those close contact professions in a much more safe manner than normally we have ever had to think about before. Although, you know, can you do it in a completely 100% safe manner? Well, you know, probably not, but we certainly understand that there's a little bit of that give and take that we have there. So, you know, in a retail store, people typically, maybe they spend lots of time, you know, there, but they probably aren't, you know, being in physical contact with strangers as long as, you know, the appropriate protocols are followed. They may not stay, you know, for long periods of time. And so that one was a little bit easier to decide, but barbershops and also restaurants, you know, are a little bit different category of risk. With restaurants, you have people who are in a room with people they're not related to, you know, they may be strangers, but people they're not normally around perhaps. They're, you know, seated for longer periods of time. You know, they're typically, if you're seated at a place, you're not 6 feet apart, you're probably a lot closer to that. And then you're actually sharing food and drink, you know, and so all those put it into a little bit different category of risk, and that's the same with these close contact professions as well. Clearly, we have to do something about that soon. Totally understand that, and we feel like the numbers are improving so that we'll be able to say something pretty soon on that. You can tell I certainly need to go myself and get a haircut. No doubt, you can tell that.
So do I. Okay, well, Dr. Harris, Dr. Wilson, I want to thank both of you, not only for being here today with us and sharing your views and knowledge with us, but also thank you for all you're doing on behalf of our state and all the citizens that are in our state to keep them protected. Thank you very much. Appreciate your time. Dr. Harris, I know you are headed to another meeting right now, so thank you all very much. I also want to thank everybody that's been on this webinar today. Appreciate you being here. I hope that you follow the Birmingham Business Alliance and already receive our communications. If you don't, please visit our website and get added on and join on to our newsletter. we'll be hosting another webinar next Tuesday with Maynard, Cooper, and Gale, focusing on navigating the tenant-landlord relationship during the pandemic. And you can also find out more information on that on our website. So thank everyone for your attendance. Happy weekend, happy Friday afternoon, and hope to see you soon. Bye.
Thank you.
Thank you.